Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? As promised, I'm bringing you plastic surgeons from across the country who can help you achieve the look of your dreams. And today, I am so excited to have Dr. Kellie Satterfield out of San Diego, California, and we are going to talk all about eyes. Thank you for being on the show.
Thank you so much for having me, Mavi. I'm really happy to be here.
I really want my listeners to get to know the people behind the magic, the people behind the magic hands. So why don't you tell me a little bit about you? How did you get started? How did you even decide to be a surgeon?
So thank you so much for having me here. So how did I get started and kind of go down this path? Because oculoplastic, or otherwise known as oculofacial plastic surgery, is a very small subspecialty, and we subspecialize in the plastic surgery around the eyes and face. So how did I find that? I'm actually the first doctor in my family, but my best friend's dad growing up was an ophthalmologist. So I got to see in high school, I would go shadow him and got to see him operate on patients and really do life-changing surgery in under 10 minutes. And that just blew my mind, someone going from being blind to seeing. And so I was really drawn to ophthalmology initially. And then after college, I was a pre-med, my whole heart was into it. And then I was kind of like, okay, this is a really big step. This is a big journey. Do I really want to do this before I, pull the trigger and go to medical school? And I had the opportunity to go with him and do a medical mission down in Peru. And while I was there, I was just helping out. I'm, bilingual, a little bit Spanish, so I was acting as a translator. And, but I just got to witness some of the patient care that they were giving and those experiences. And one of the most impressionable patients on me was actually an oculoplastic surgery patient who had tearing. And, he was trying to provide for his family, but he had a really hard time kind of seeing through, the tears. His eyes were watering constantly. So he had a really hard time working. So getting to see, the impact of those surgeries and helping people kind of get back to being their functional, empowered selves, I just absolutely loved. And then going to medical school, I just loved plastic surgery. I've always been an artsy one. This is my little home decor behind us, but I love design. I love art. I love, doing all the different types of things, and experimenting and dabbling in the arts. And so I almost went into plastic surgery, but I really loved ophthalmology. And so I found oculoplastics, and I love how challenging it is. It's very, very rewarding. And, when you're making incisions on someone's face, you have to be really on top of it. And I loved being able to kind of guide patients through that, but also kind of be the one to help make those important decisions with them.
Wow, I love that background.
Yeah.
So now that we've heard all of that, I feel that talking about our next topic, our listeners are really going to understand why you're such a perfect person to speak about this. And we're going to talk about eyes in general, but mainly under eyes. A lot of us really deal with problems with our under eyes. And on this show, I like for my listeners to feel like we're having a little mini consult. They get to hear kind of dip their toe into it. So when you're looking at somebody's eyes, they're coming in to see you. What are you normally looking at to assess what they might need?
Yeah, so I think you're exactly hitting it, nail on the head there, because under eye treatments are so variable. And sometimes what somebody, quote unquote, needs to optimize their under eyes is so minor. And then other people, it's definitely more extensive. When someone first walks in, the under eyes, I really break them down into three categories. One is the infrastructure under the eyes. We have a fat pad in our under eyes, or a couple fat pads actually. And then we have a fat pad in our cheeks. And it's really the junction between those two, which I think largely contributes to, dark circles and having that shadowing or tired appearance under the eyes. But the other two categories that sometimes you don't have to address, but sometimes are very important to address are not only the volume of skin, but the texture and quality of the skin. So if somebody has a lot of sun damage, doing a chemical peel or a laser could be really important. If somebody, has lost a lot of volume or elasticity in their skin, say they're in their 60s or 70s, then sometimes doing a small skin pinch or skin removal is important. But I would say for most people, if you change the underlying infrastructure of getting that junction between the under eye area, the true eyelid and the cheek more smooth, especially in the center area, that's going to make somebody look, way more refreshed and much younger.
Oh, I love that. So for my demographic, most of my listeners are between 25 to 45.
Yeah.
But mainly that like 30 to 45 range. And my listeners are in that range. So let's talk about that demographic. So when you see somebody in that age group coming in, what are their usual concerns?
So I would say, a lot of people come in because they, the cards that they got dealt with genetics is that, oh, my mom really had these and I saw her and she never got anything done. Or maybe, oh, she did get something done, but I don't want to wait as long as she did because she was so happy afterwards. Or, she never got anything and, I want to get refreshed now kind of a thing. So I think it's extremely common, women in their 40s, because we start losing volumes in our mid-face around kind of our early to mid 30s. We start losing that volume. And so you can start to see a little bit more hollowing, maybe a little bit more shadowing, some more of that purpley bluish hue in the under eyes. So for that specific kind of population of women, especially in their 40s, most of the time, what I typically recommend doing is a fat repositioning technique where I basically borrow some of the fat from their own fat pads and then transfer it and kind of reposition it down into the cheek. And that helps revolumize the cheek and depuff the under eye area. And then, it kind of depends on someone's skin type. But what I like to offer is either laser resurfacing to kind of help tighten the skin, or doing a chemical peel in the area can be really wonderful as well. Now, I would say the biggest difference is kind of the need for a skin pinch in the under eye area. And if, doing a skin pinch for that population, sometimes you can get away with it. But if someone has had, it's kind of 50-50. If somebody's had quite a bit of sun exposure, then maybe doing a little skin pinch, a conservative one, is appropriate. So I would say in, kind of mid 40s to 50s, it kind of goes either way, but kind of creeping up into the 50s, I would say you usually opt for a skin pinch.
What about darkness? What about dark circles? That I feel like I have somebody asking about dark circles every day.
Yes. So dark circles are tough because there's a lot of different things that cause them. So this is kind of a fun fact, but our eyelid skin actually has zero fat underneath it. Like immediately under it, we actually have a muscle called the orbicularis that kind of encircles our eye. And so that kind of helps us when you squeeze your eyes closed, that whole muscle is there, but there's no fat in between the skin and the muscle. So that muscle can kind of be a little bit more purple. And if you have any decreased collagen or thickness of your skin, then that can kind of shine through and you can see that vasculature more or less. Other reasons for having dark circles, kind of shadowing overhead. Like I was saying, with overhead light, we live in a world full of fluorescent and overhead lighting. You really get that, you can see a hill from the under eye and then you see a valley from this separation here in the under eye area. It's called the tear trough area. The other reason for dark circles can be genetic, depending on someone's background, they can have hyperpigmentation there. The treatment really for that is, topical skincare. One thing that's very interesting is fat actually can be used in the under eye area. So there's something called microfat, but then there's nanofat. So microfat is used for volumization, but nanofat is actually basically stem cells. And so it's like basically a yellow liquid. We call it liquid gold. And that can be injected in the under eye area for the skin to actually brighten slightly. So, if you have genetic hyperpigmentation or, darker pigmentation around the eyes, that can be beneficial. There's certainly some skincare. And then, part of the other thought to dark circles under the eyes is if you have teeny little folds or wrinkles, that actually allows for little shadowing in the under eye area. So, doing laser, chemical peel, all those things can kind of help optimize, which is why we kind of do a lot of different things at once rather than, one single category really to get it just right in the under eye area.
I want my girls to think about it like you're going into this, like, what's the recipe? What is
Yes.
the recipe that's going to get me the cake that I want?
Yes.
And not really like, where's the flour? Not just one specific thing, but more of what are all of the things that are going to get to the final result, which would be, so you're saying skincare, under eye stem cell treatment with
You could, the nanofat. Yeah, absolutely.
nanofat. And then there's that third thing that a lot of people do, and I'm not a huge fan, which is tear trough filler.
Yes.
I think I want us to get into tear trough filler. We could talk about it for hours.
Okay.
So for our listeners, what is usually tear trough filler, and just kind of go through that?
Sure. So when someone comes in my office, sometimes people come in and they're like, I want tear trough filler. They come in and they're like, I want surgery, and they've already kind of made up their minds. But if somebody's kind of waffling and they're like, hey, I just want my under eyes to look better, these are kind of the things that I discuss with them and say, hey, this is option A and this is option B, and this is why I think you should choose one or the other. But I would say for the most part, unless somebody has a really strong, puffy under eyes, which some people do, people who are in their 20s, I think, unless you want a permanent solution, that tear trough filler may be appropriate for you. However, I always caution people and say, this may look good now. It may look good for 5 years. It may look good for 10 years, but eventually it's not going to look good, and it's going to start to look a little bit funky, and you're going to have to get it dissolved at some point. So you may forget that you had tear trough filler 15 years ago, but one day it will kind of cause a little bit more bluish hue. It will kind of migrate and move a little bit. Historically, we thought fillers stayed in the face for a year. I think that's largely, obviously been disproven at this point, especially in the tear trough area compared to other parts of our face. That filler sticks around a really long time and can cause a lot of weird puffiness as our skin loses elasticity. So I usually say if somebody has any stretch to their skin, if they don't have enough, saran wrap is usually how I like to say it. If their skin isn't tight enough to kind of hold that down, then tear trough filler is a really bad idea because it's going to get puffy. It's going to get blue. It's just not going to look natural. And they're going to wish, they hadn't done it. So somebody who's getting into their kind of 40s, 50s, I would say I really would kind of opt away from tear trough filler. Now, getting filler in the cheeks to kind of support your under eye area may not be a bad idea, depending on, some people don't have fat to transfer. So if you're thinking of having a fat transfer, sometimes doing filler instead can be a nice kind of stopgap if you're not wanting to undergo something like that or don't have enough fat. But for patients in their 20s and 30s, I do sometimes consider doing tear trough filler. But if they want a permanent, long-lasting solution, then really, surgery is kind of the best option to address that.
I agree. I agree 100%. Because when we're talking, I like to talk to my girls, real talk. Let's talk for real. Okay.
Yeah.
So if you're going to start doing under eye filler, how long, how many syringes, how often are you going to have to do it? What is the total cost of doing that over time? I know initially a lot of women will go towards it just because of cost, because doing
and no doubt, such little downtime. Yeah.
Doing them To me, it's a minor procedure. You'll be fine. You'll be okay.
Yeah.
A procedure that they're going to have to take care of, do some downtime, and the
Hmm.
cost is also higher. I feel like they'll opt for the cheaper option, which is filler.
Sure.
So comparing them as far as pricing and downtime and all of those things, let's break it down for them a little bit.
Sure. So, as far as filler, there's no doubt about it. That's going to be way cheaper than surgery, right? You're not paying for anesthesia. You're not paying for a whole OR team. You're not paying for all the, summative years of a surgeon's training. And so, some nurse injectors or aesthetic injectors do tear trough filler. So you don't necessarily have to go to a surgeon for that or a physician. I would say for the most part, usually depending on someone's anatomy, about half a cc per side. So a 1 cc syringe should be plenty for the tear trough area, specifically to address this inner region. Now, if somebody has a lot of volume loss in their cheeks, then that number may go up. But syringes can vary depending on what somebody's choosing to inject and their pricing, but they're probably more in the like $600 to $900 range, I would say. And some clinics, may even split it if they're doing a really high volume. They may split their syringes or allow you to share with a friend or something like that, where they break it into 2 syringes out of 1. So yes, it can certainly be more affordable. As far as need to repeat it, that is a super big red flag for me. So if you go to my personal opinion is if you go to an injector and they're like, oh yeah, come in for 6 months for your touch up, or come in for every single year because you need more filler, eventually that filler builds up over time. And so my personal kind of dogma is that you should only go get filler when you feel like there's something to address, or, you're losing some volume. You're like, yeah, I think it's time for a touch up. But sometimes in certain people, that under eye filler is going to last you 5 years or 10 years. And in other people, maybe they go every 3 years or every year for a couple times. So I think the volume is really variable. But when you've gotten under eye filler, if you're getting 2 or 3 syringes, that's a pretty high volume. And that filler is going to migrate and move. Part of my protocol actually before, if I ever do operate on someone for under eye area rejuvenation, is it's an absolute must to dissolve any filler that they've had before, because for a couple of reasons. One is that filler in the under eye area is just like a sponge, right? And if I'm doing surgery on you, that's just going to cause so much swelling. It's going to make your recovery really, really long compared to somebody who'd never had filler before or had the filler dissolved. And then the other thing is too, if I'm trying to finesse something and do a permanent graft, or I'm taking fat from point A and I'm moving it to point B, I don't want any filler to mess up the contour, because that filler can move, migrate, do its own thing later on. I want to be sure I'm putting it in the perfect spot for somebody's anatomy. And that really requires me to have a blank canvas to really work off of. So, for under eye filler versus surgery, absolutely the cost is going to be less. But again, just know if you are considering it, it's totally fine. Know that you are going to have to dissolve it at some point. And just keep that in the back of your mind when or if you ever decide to do under eye rejuvenation with a more, surgical approach.
And with surgery, it would just be a little bit of lipo somewhere. Maybe, where do you usually like to get your fat from?
So I think the easy access points, there's a lot of good fat, a lot of places on the body, but I think the abdomen is very nice. It's very easy, and I would say very comfortable for most people. And there's usually some volume and it's a place that people don't really miss fat being taken from. The other place is the thighs. I think are a really good point to take fat from. Now, I will say for some of my under eye rejuvenation, if I am doing surgery, I would say it's about 50-50 actually, whether or not I recommend transferring fat at the same time. It really just depends on how much volume somebody has, and then also other lifestyle factors to consider. Maybe say somebody's losing a lot of weight and is in a period of, a lot of people are on GLP-1 agonists, and maybe their weight is fluctuating a lot, or they recently had a lot of weight gain, or maybe they're in menopause and, their hormones are fluctuating a lot. And so kind of where their fat is being distributed on their body, maybe shifting a little bit. So doing a fat transfer, I think, is great to support the cheek for many, many people. But some people actually have an appropriate amount of volume, or they're younger where they still have a really good amount of fat in their faces. And so they don't necessarily need that fat transfer. They just have, you know, a little shadowing in the inner corner, and we just need to basically transpose that fat to make them happy. I will say one thing that we didn't touch on. It sounds like, you know, you kind of know there is, I would say, a common recipe that a lot of, you know, the top docs in the nation are doing. But lower lid blepharoplasty, I just wanted to say, you know, on this platform, it can mean a lot of different things. There are a lot of different techniques out there. And one thing that I would say blepharoplasties of, you know, times past, and, you know, some people still utilize those techniques, is they go from an external incision and they go through the muscle. And if you go through the muscle, that really puts someone at the biggest risk of changing the eye shape, because the under eye muscle is kind of like a sling. It's a little hammock that holds our eye up. And so if you go through that muscle, not always, but sometimes things can get distorted, or you are at risk of the eyelid kind of pulling down and having more of that puppy dog look. And so I do, in very, 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 very select patients, will still do that approach to surgery, but they have to have really specific anatomy for it. For the most part, I keep that muscle intact. And I think that's really important to kind of talk through what type of approach that your surgeon does and see, you know, what is the risk of doing it this way versus that way. But there's no doubt about it. The research has shown going from the outside and going through that muscle puts a patient at higher risk for the eye changing shape. So that is absolutely something for lower bleph that I want people to know.
Good. I love it. Yes. Give us all the juice. Give us everything.
Yeah.
So let's talk a little bit about upper eyelids.
Sure.
So what do you look at when a patient is complaining about their upper eyelid? How do you usually decide what procedure they're going to need?
So I think the upper eyelids are very confusing because, one, they're so dynamic, right? I mean, they are part of the core of our facial expression. I think of the upper eyelids really like kind of a set of curtains. So your eyebrows are the curtain rod. The drapes are your upper eyelid skin. And then, you know, more or less, you know, the very bottom of the curtain, you could consider there's fringe there. Those are really your eyelashes. And so that whole process is extremely dynamic because some people come in, you know, women in their 40s, most of the time they have very small changes where their brows have started to come down just a little bit. They may have some fullness on the outside of their eyelid, and that's called lateral hooding. And so, and then depending on the person, maybe they have a little bit of droopy as you're doing it. And then depending on the person, you know, some of it's genetic, some of it maybe from, you know, contact lens use for 20, 30 years, they start to get a little bit of a droopy eyelid where their eyelashes hit lower on their eyes. So good examples of celebrities who have that would be like Billie Eilish, you know, or Marilyn Monroe. Their eyelids are a little bit lower and they kind of have more of a sleepy eye appearance. And, you know, not that that's necessarily bad, but it is. And in some people that can be asymmetrical as well, where you can have more sleepy eyes on one side versus the other. So when people come in for, you know, upper eyelid refresh, I would say the common things being common, they really just want a little bit of skin removed. But if you're really being a perfectionist about it, and then someone's in their 40s or 50s, really kind of the tail of the brow should probably be addressed in some capacity. And there's a lot of different types of brow lifts, so we can talk about that if you want. And then the other component is something called ptosis, which is that eyelash position. So it's super dynamic. It's very complicated. And so that's why I think going to oculoplastics is nice. Certainly there's a lot of excellent facial plastic surgeons who also understand that anatomy well, but it is a very complicated area and it's kind of easy to get wrong, where sometimes after surgery, you know, I have patients see me for a second consultation after they've had surgery elsewhere and they're like, they remove skin, but it just doesn't look right. And it's like, well, that's because you had droopy brows, or that's because you had ptosis that wasn't addressed. And so, you know, it's just not looking right because the equation wasn't right from the start.
And I think that is a perfect lead into eyebrows, because
Yes.
I see that exact scenario that you're speaking on all the time, where it's like,
Hmm.
well, you probably needed a brow lift, not a
Right.
blepharoplasty.
Yeah, absolutely. So brow lift, lower lid blepharoplasty is complicated, but if you want options, brow lift is all over the place. So there's so many different types of brow lifts, and I can kind of give at least the 30,000 foot overview of what some of those look like. So I would say the least invasive and probably least strong type of brow lift would be something called a brow pexy. And most of the time that involves when someone has an upper eyelid blepharoplasty, we go through the natural eyelid crease. And then you can go right underneath. We have a little fat pad in our brow, and you can kind of tunnel under that and basically release that a little and put supporting stitches underneath. So it's kind of like wearing an underwire bra. You're kind of cinching that down and getting that brow fat pad to be a little bit more perky. Because we lose volume there with age. And so it's kind of a nice supportive maneuver for very, very minimal, mild lateral hooding, which is excellent for people in their 30s having blepharoplasty or their 40s. Once you kind of get into your 50s, you may get away with doing a brow pexy, but you may need something stronger. So there's a lot of different options for stronger brow lifts. One that is, I think, probably underutilized, but, has consequences. Whenever I'm talking patients through brow lifts, I say each one has consequences. So it's just pick your poison. The brow pexy is not as strong, but there's very little risk to doing it. The second option would be a direct browplasty. So what you can basically do is make a teeny incision right above the brow hair, and you can take a very strong, you can take a little bit of skin there, and that is a really strong brow lift where you can get a lot of lift, and it's, minimal downtime, can be done in office. The downside is you have a scar above your brow. And so if you do not have bushy eyebrows, probably not a good surgery for you. Or if you don't care about having a scar, then great. If you have an eyebrow tattoo, I love it because I feel like it hides really well. And then the people who already have that are like, oh yeah, I can just go get a touch up if the scar bothers me, because it's really beautiful, in that I think in the end heals really well. But for a couple months, it's pretty obvious that you have a scar there. So that's great because there's very little risk as well, with the brow pexy, the lateral direct browplasty. The other types of brow lifts definitely have more risk involved and are more invasive. So one approach is to go through kind of the hairline here and just address the sides and kind of do, there's some surgeons who call it more the ponytail. So it's kind of lifting in that direction where it's pulling back in this way. That is, you can do it in endoscopic style or endoscopic brow lift. And that basically is a bigger surgery. So I do that type of surgery as well. Yep. So I do that type of surgery. That one does require you to go under general anesthesia just because there's a lot more dissection. I always tell people, you're going to look like a head trauma patient afterwards because you wake up with a big bandage over your head and you kind of have like a bandage strap around your head and you have to wear that for a couple days. There's a lot more swelling. It's bigger, but, more risk, more reward, or more, more to go through, more reward, where you can really get a nice lift in that area. I would say most people, that is an excellent option and more of a modern technique because it is minimal incisions. And I would say it really doesn't change your facial expression. Brow lifts of times past is, surgeons would lift a lot in the central or medial brow, and that would make people look surprised, scared, just odd. And so, there's a lot of celebrities who got a lot of flack for having bad brow lifts, and it still happens on occasion. I definitely see, some patients where they're like, can you revise it and actually lower my brows? And so that's something that sometimes I get asked. San Diego, there's a lot of plastic surgery here in California and Southern California, but endoscopic style brow lift is great. Now, what are the downsides to that? Okay, because I've only told you how wonderful it is. The downside of that is anytime you make an incision in the forehead or really, the hairline, the way that the nerves supply sensation to our scalp is they come actually from around our eyes and they travel up and go to the top of our head. So if you make an incision here, anything behind that in that territory is going to be numb, and it's going to be numb for a really long time. And there's always a chance that that sensation never really comes back fully. So if you blow dry your hair a lot, there's a chance that you could burn your scalp. So you have to be super careful about that. Or if you're using, that sensation is just not there and as well. The other risk of doing a procedure through kind of the hairline for really any of them is that our nerve that controls our forehead muscle runs right above our brow, kind of in the center of our forehead. And there's always a risk that that nerve gets done temporarily, or, super, super rare and uncommon, but you could have permanent nerve injury in that territory. So it's a lovely surgery, but it's definitely a lot more to go through, a lot more healing. Patients, may borderline of, kind of asking for narcotics afterwards, or they definitely have more pain to kind of address. People just get headaches from it. And it is just a little bit riskier. And so I love it. I think in the right person, it's great. But I definitely, I don't try to scare people away from it, but I definitely want them to know and be mentally prepared to kind of go through a bigger healing compared to the other two techniques. And the last one that we didn't talk about is doing like a pretracheal brow lift or tracheal. So tracheal means like hairline involved. And so sometimes people still, like if they have bangs, I'm like, ooh, excellent. Like you would be a great candidate for this if you don't, wear your hair in a certain style. Especially for those women who genetically, they just have a very either low set brows or are more Nordic, I would say, or depending on their ethnicity, but basically have a much lower set central brow can be really beneficial to have a very strong brow lift in the center to lift that. But I would say that's a pretty rare patient that I'm making a really big scar that is not hidden anymore. It's really for very specific people, but that's kind of why I love brow lifts, because there's so many different techniques. And it is so customizable, but it's hard to kind of know which one that you qualify for until you kind of go in and ask and say, okay, what are your thoughts on this technique, this technique, this technique?
I love it. Thank you so much for breaking that down for us. I know my listeners are loving this because we love to learn all of the different things. So the ponytail lift, y'all, if you're following me on Instagram, I've been obsessed with Lindsay Lohan's transformation and Anne Hathaway's and all of the celebrities. So the common thread I kept seeing was that she probably had a ponytail lift. And so I was super excited to hear that you do the endoscopic lift because not that many surgeons out there are doing it.
Yeah. So, I think the ponytail lift is trademarked. So I wouldn't say that I do,
okay,
I just want to say, just to be clear, I don't do quote unquote the ponytail lift. But I definitely do endoscopic style brow lifting. So the, endoscopic versus endoscopic style basically means, do you stick a camera in there and look, or do you do it by, knowledge of the anatomy and feel? And so they're basically the same technique. It's just a matter of, the surgeon's preference if they have a camera in there versus not. Yeah.
I think it's funny. So for our listeners, there's different procedures that are out there that get trademarked by surgeons. Mm-hmm. So it's like a surgery that's very common, but they call it something specific. Yeah. For some of these examples are S-curve, O-shot, vampire facial.
Vampire facial is a big one.
This ponytail lift. There's a lot of procedures out there that the names are trademarked. Mm-hmm. So you can't really market and say like, hey, I do that too. I just call it something different.
Yes. Yes.
So that for our listeners, just so y'all know, that's why she's being clear about that.
Yeah. So I just don't want to cease and desist letter. But no, in all reality, yes, I think a lot of surgeons name their surgeries and, they're doing their specific thing. No surgeon does something exactly the same. And so if they want to call whatever they think their secret sauce is something, I think that's great. But at the same time, I think it does add some mystique and make it seem special, which, for better or worse, that's kind of what it is.
Yeah, exactly. So,
Yeah.
okay. So we talked a little bit about under eyes. We talked about
Hmm.
under eye circles. We talked about upper eyelid bluff, and we talked
Sure.
about brow lifts. So what about mid face? I know you do mid face as well. So how do you usually, and I ask all of my facial surgeons, how do you usually decide what to do for a face?
Yeah, so I think mid facelifting, there's several different ways that you can get to the mid face. If I'm operating and doing under eye surgery, then my access is kind of easy, and typically I access that through the under eyelid incisions. However, going through the temple is definitely another approach that a lot of surgeons utilize, or if they're doing a facelift. So I've trained on facelifts. I know how to do facelifts, but currently in my practice, I am not out there seeking facelifts. I think there's a lot of wonderful surgeons in San Diego or in elsewhere who do them. But I think the mid facelift is powerful, but I think that a lot of, at least as far as eye rejuvenation, I think with more and more fat grafting that's happening, there's actually a little bit less of a need for mid facelifting, at least if you are focusing on the eye area specifically. I've actually found in my practice that I'm doing less and less mid facelifts, not because I don't like them, but just that I feel like I'm getting really amazing results without doing them. And so I think that, yeah, it's just kind of an interesting pattern that I've noticed.
Yeah, I love it. So for my listeners, if they want to
Hmm.
come see you, how
Yeah.
can they find you?
Yes. So my practice that I started is called San Diego Eye and Face. And if you want to reach out to us, you can get to us at our website. It's sdiface.com, or you can find me on Instagram. My Instagram handle is Dr. Kell, and you can reach out there. I'm also a Persona verified physician, so I do offer virtual consults through Persona, which is like a concierge type thing where you can reach out to different cosmetic qualified surgeons. So that's kind of nice. And you can just send me a DM if you have a question about that. And it's HIPAA secure, which is beautiful. So there's a lot of good ways to do that. Or you can call our office or text us. It's 858-284-0608.
I love it. Thank you so much for being on the
Thank
show.
you. I really
And with
appreciate it,
that,
Mavi.
you're very welcome. So with that, you guys, I'll see y'all next week. If you have any questions for Dr. Satterfield, send them into her DMs. And I'll see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.